Hello, my name is Justin Diaz.
Hello, my name is Brennan Sandoval.
Hi, my name is Samantha Sarmiento.
And hello, my name is Fabiola Cuevas, and today we're going to present the topic of HIV prevention in Eswatini. The research question at hand will be, to what extent has HIV prevention measures in Eswatini been effective in reducing HIV? This is important because HIV in Eswatini has currently been the highest out of all the countries in the world. So overall, the prevention for HIV in Eswatini has not been so effective because of poor economical force, historical trends that demonstrate frailty in the government and just overall the handling of the situation, and poor medical facilities. However, HIV prevention schemes in Eswatini have also presented the ability to protect the people from HIV through the use of contraceptives such as condoms and PrEP, pre-prophylaxis.
Now, with this problem comes many solutions and limitations with these solutions. One of those solutions being that health officials could force upon treatment upon the adherence of HIV in Eswatini, and this would furthermore limit HIV across the area. However, as we will explore further on, this does not coincide with cultural beliefs, and it could actually lead to people feeling threatened by the medical disease. Now, another possible solution could be to enforce sexual education upon minors in Eswatini, but not all children have access to public education in Eswatini, as poverty is at a high.
There is a lack of a strong government system that reduces the opportunities of healthcare and sex education in Eswatini. Lack of human resources capacity is a major challenge to scaling up antiretroviral therapy in Eswatini. The recruitment and retention of staff is constrained by poor working conditions and limited incentive. A system to ensure the continuous supply and distribution of AIDS medicines and diagnostics needs to be established. Laboratory capacity is being strengthened at the central level, and the same needs to be done at the regional level. HIV prevention strategies need to be strengthened. An integrated strategy for information, education, and communication needs to be developed, targeting young people and vulnerable populations. Okay, so on the left, it's people with HIV, and on the bottom, it shows throughout the years from 1990 to 2009, and as you can see, the amount of people with HIV skyrockets over time. And on the right graph, it shows the top 10 causes of death in Swaziland, and the red represents HIV, and that takes up.
Taking a look at the social effects of HIV has on Eswatini as a whole, we can look at how men are typically scared of hospitals and the environment. They show a general reluctance to medical treatment, as we can conclude that they believe that there's poor service and long waiting times for attention in the hospitals. And this correlates with cultural and social preferences for the people of Eswatini as a whole and the struggles they face with HIV prevention. Alongside medical attention being an issue for the Society of Eswatini, it also has various effects on different types of people. This can include genders, sexualities, etc. And when catering to all genders and ages, medical professionals need to find a way to treat certain people. For example, with the LGBT community in Eswatini, HIV treatment has increased violent tendencies across the communities, but while that is an issue, it has also led to the increased moral support of the LGBT community in Eswatini. For example, with age differences with the disease in Eswatini, younger populations are prone to this disease, as safe sex is not truly practiced in Swaziland, as many children do not have access to public education, and condom use is also limited, as people are grown in poverty and lack certain education with these issues.
Contrary to what my teammates have said before, Eswatini, despite all that they're lacking, have made great strides in the past years. As you can see on the graph to the bottom left, from the years 2000 to 2016, there's been a sharp decrease in estimated of people newly infected with HIV. This is a graph found in who.int. And this trend right here to the left shows that despite all that they're lacking, despite all the economical force that they're dealing with, they're still investing what they can and doing what they can to fight against HIV. And on the graph to the right, it shows the actual statistics of the HIV cases that are present in Eswatini. As you can see, some examples are the estimated people that are living with HIV. You see it's not even adults, it's also children that are living with HIV. They get it from birth, or because the economical workforce is so damaged that there's a prevalent amount of sex workers that also are damaged with HIV, and they struggle with it day to day. Sex workers come in all ages, 15 and up, as you can see on the third row. 130,000 of them are living with HIV. And this graph is just basically showing that it doesn't matter what age you are, Eswatini has just such a thick amount of HIV present everywhere. Here you can see all the plans that have been integrated in Eswatini, either by the Eswatini government or by the collaboration that they have with the CDC. So Eswatini is not only working alone, they also have help from outside countries. So here you can see the HIV-ST plan, which has been implemented already fully. You have the adaptation of WHO key population guidelines and national plans, also implemented fully. All these plans are for one purpose, that's to reduce the spread and help try and fight the spread of HIV in Eswatini.
So we're all here with what was previously mentioned about PrEP or pre-prophylaxis. And there is a study made by a lot of experts who specialize in sub-Saharan Africa and HIV that focus on men who have sex with women. And here it represents that although Eswatini has done its best efforts to provide services and things so that the people of Eswatini can improve their safety, not a lot of men have taken up on PrEP because of a variety of reasons, which may be like here, as you can see on the graph. They don't even have a knowledge of PrEP because it is very recent and it was just implemented in Eswatini in 2017. They do not want to disclose a reason, and they have concerns about pill taking and just a lot of other reasons. And overall, so, however, going along with this, although there's a lot of people that don't know about it, going along with the paranoia and rising fear that's growing among the people of Eswatini, a lot of people are going to clinics and trying to take that care from the clinics. And for here, it may be because they have a partner with HIV, they want protection against sexual violence, and they have a lot of partners and just want to negotiate condom use, which is still not very ideal because PrEP is just an addition to condom use and should be used both at the same time always. So overall, it is very, the way that Eswatini will deal with this will because the people are getting more access to PrEP because of the government, and overall because of the paranoia that's growing among the people, it will, so.
With all this information, it is concluded that there is the best solution possible to treat the people of Eswatini and to get rid of the HIV epidemic is to cater to the cultural beliefs first and serve the people of Eswatini rather than the economy or the business side of the HIV treatment. Thank you.
Any questions?
Thank you. I was waiting for that because I just wanted to make sure you guys are ready for that. All right. Yes, I have a question for each one of you. We're going to start with you, Brandon. Brendan, if you would, describe how the content of the team presentation changed as a result of discussions between you guys.
As a result of discussions, the content definitely changed as we were open to each other's perspectives and viewpoints on the topic. For example, Justin takes more of an approach of how the treatment is actually positive and helping the people of Eswatini, while my perspective and that of Fabiola and Samantha are more showing how it can be changed for the better and how overall the treatment is not necessarily effective.
All right, thank you. Sam, you're up next. Reflecting on your colleagues' work, what everyone else wrote, which one had the greatest impact on you to understand what this was all about?
For the greatest impact, I'd have to say Brandon, because his lens was mostly social, and it helped me understand what it was like for Eswatini, like as a population, rather than just like numbers and how the government works in the economy. So I'd have to say Brandon, solely because he brought to the table more or less what it was like for the people, rather than like the people that are higher than them. So it helped me understand better why Eswatini needed more help.
All right, thank you. Fabiola, you're up next. In what ways did you improve your ability to work with a team as a result of this project?
Overall, it just really showed me that you have to continually communicate and just have better abilities to time manage and not procrastinate. Just always, and it also teach me that just probably just talking more to people and reading on their perspective, like by reading their RRRs, could improve your understanding of the topic and just like of your partners overall. Like reading Brandon's IRR really helped me a lot because it was very similar to mine, and it just gave me a lot of insight.
All right, and obviously, Justin, let's say, is the best for last. What was the strongest counter argument to your team's solution?
The strongest counter argument would be the points that I brought up, that when I was saying the counter argument, which was that Eswatini simply doesn't have the economical force to really drive a wedge into the HIV spread. So that they don't have what they need. They're relying on help from other countries to really fight against what's spreading, which is HIV. They're struggling to manage the spread of it simply because their economy is not very good and it's still failing, which is why my graphs show a decrease. But then as the years are going on, it's becoming more of a stalemate. So the graph is evening out. It's not becoming any better.
All right, thank you.